Hey everyone, I'm back. Just wanted to make a video. I didn't make any for a couple days because my roommate was off and I don't usually make videos when anyone's here. And plus I haven't been feeling that well. Surprise. You know? What? You're not feeling well? That's rare. No, but you guys know how I'm like really against a lot of different medications, but I'm really considering getting one. One of the prescription drugs that they had me on before, Prevlicid, was at the time only available by prescription, and now it's over the counter, and it's a much lower dose, but like anything else, you can just double it up to make it prescription strength if you had to. And I know that's what they would give me anyway at this point, just having a lot of burning going on. And it's weird because, someone had mentioned to me, well, actually a couple people, but the most recent person is just like, well, you should be really checked for celiac disease. You could have a gluten intolerance. You sound like me. Maybe. I don't know. But I will say this. I mean, I don't know. It could be, when it comes to the upper part, I mean, I have so many problems, as you know, but when it comes to the upper part, it could be GERD, acid reflux, whatever. But what's interesting is, I have it over here, is, like, when you have heartburn, people are like, oh, eat bread and stuff like that. So I was eating bread, and shortly after I eat it, I mean, my stomach goes on fire. And I woke up today and I had, some bread, and now it's just really burning in my stomach, and it makes me cough a lot. I don't know why that happens. I'm trying not to cough right now, actually. That's why I'm always clearing my throat in my videos. It's like I always have like stuff like hitting my throat, and it hurts to breathe. I think that when I'm sleeping, if it is acid, that I'm somehow inhaling it, or not like into my lungs, but just it's irritating like my bronchial tubes or something. Because I get these coughing fits and it'll wake me up, or I wake up and I'm not breathing. But it's not like sleep apnea. I mean, it could be, but it's not like that. It's kind of like I can be laying on my stomach and all of a sudden, like I get this horrible burning sensation, and it's like it's hard to inhale. It's almost like I inhaled some type of acid. I don't know. But I wasn't going to make a long video today because I'm really not feeling that well. Just trying to think if there's anything else that's going on. I talked to my mom. She's doing okay. She has to go for her pre-op blood work soon, and then she's still having the surgery. Nothing's changed yet. But her leg, like, okay, she had this leg thing where about a month ago, her left leg, I believe it was her left, swelled up. And she's said to me on the phone, well, it's because I sat there for a long time, I think, and I just didn't move it. And I was, no, back in December, because she was like, oh, I was wrapping presents, and I think that I was leaning wrong on my leg. And I said, well, Mom, people lean wrong on their leg all the time, and, excuse me, I'm telling you, it's burning bad. And so, I said to her that, go see a doctor. And so she did, and they didn't really know why, and they gave her some, like, anti-inflammatory drugs and some blood thinners, and then it went away. And then now, and she had to use a walker for a while again. And then now, she tells me the other day that her leg was swollen back up again, but it was her other leg this time. And I said, well, why they say it happened last time? And she's like, oh, just because I sit wrong. And this doesn't sound right, to me. So I said, well, what did you do? Did you call the doctor? And she's like, no, I'm just waiting for it to go away. And then she tells me today it's still swollen, and she's having a hard time with it. And I was like, Mom, call the doctor, because you can't just go have surgery if there's something wrong with your leg, that could prevent it. You might want to tell someone. She's like, oh, I will. But it's kind of like, I don't know. Like I said, she's forgetful from the chemo that she had in the past. And she was already kind of forgetful before she ever had cancer. So now it's just kind of, I don't know, I hope that she calls someone, is what I'm trying to say. And other than that, nothing much. It's freezing cold here. It was a little bit warmer today. And that's it. So just kind of babbling today. I just wanted to give a quick update. Sorry the video is kind of short. I'll try to be more talkative maybe tomorrow. But other than that, but yeah, I might try to get the Prevlicid. I'm not sure. I thought about doing ginger again because that helped. But then, sometimes ginger like can cause heartburn, and that's the last thing that I need going on. I don't know. So it's kind of like, with me, just to make this quick, it's burning up here, like really, really bad. And I have the other problem where when I'm standing, my heart rate is sometimes as fast as someone running full blast. So between that and the heart rate and just maybe not sleeping well. It's not good. And, you know, still have to call, some doctors. I guess I'll talk a little bit longer because what I was going to say is I have this major problem. I have to see so many doctors, like, because everyone's like specialized now. It's not like in the past you went to a primary care doctor and like they were able to do a lot of things for you. Now it's okay, you have to see the gastroenterologist for that. Oh, you have to see the cardiologist for this. Oh, you have to, see a proctologist for this. And you have to, go have an allergy test with the allergist. And oh, well, your eyes are doing that? Well, you have to go see someone, an eye doctor. Oh, you have to have the lung x-ray done? Oh, okay, well, I can send you for that. But if it comes back weird, you have to see the pulmonologist. It's like, for someone with anxiety, I don't want to do that. I mean, it's not so much about wanting to do it. I think that a lot of times I can't get across to doctors is I won't do it. And I'm assuming people with anxiety understand this. At one time, maybe last year, I was in the ER and I just said, look, I've never asked this before. Could you please just admit me to the hospital? Because I'm thinking you could just do all these tests really quick with me and get me in and out maybe in 4 or 5 days. And I won't bother you. Once I know what's wrong, I won't bother you again. I mean, trust me, I don't want to be there. But I don't have a support structure. I mean, my mom is sick. My father has to be with her quite a bit. Anything can happen at any time, and he might have to take her to the hospital. My father is not always completely with it. I mean, he's better off than my mom, but his driving skills have really gone downhill because of his age. So could he take me to these appointments? Yes, but at the same time, I'm always saying, Dad, don't turn left. There's a car coming. Okay, well, now if I'm coming out of anesthesia, I can't do that, and I don't feel safe. And my roommate, Keith, no car. Other than that, no real friends. And no one that I'm, like, I mean, there's people that will say to me that live locally, well, I'll take you, but I don't know them that well. And so, I mean, that'd be nerve-wracking for anyone, but for me, on top of that, I'd just be trying to, hold it together, and I cannot right now hold it together for somebody else. So, I feel stuck, like really stuck. I can't necessarily take myself to these appointments. I mean, I've worked out the blood work somewhat. I thought, well, okay, I know a place I can do home draw for that. But it's still scary. It's like, someone may not be here after that person leaves. I could pass out on the floor from it. I have to, lay in bed. I have to clean this apartment. My roommate doesn't clean. I don't clean, so I'm not blaming him. It's just that now, okay, crap, I have to clean the apartment, and I know he's really not going to. And how do I do that when I feel like this? And I was talking to him on the phone earlier, and I was saying to him, it's not always anxiety. Like right now, well, okay, not right this second, because I'm okay enough right this second, but about an hour ago, if I had to mail a letter in the mailbox, I wouldn't be able to, and not because of anxiety. I just felt too crippled by being sick. And I was sitting here, like, just holding my stomach and just, like, had my head kind of down, waiting for it to pass. So what if, instead of having to go, if I couldn't even go to the mailbox on the corner of my own street, how would I then get into my car, drive to a doctor's appointment, and sit there when I can't even do that? And then if, on top of that, at that point, I would have anxiety because I have a lot of anxiety going to doctors. So I just don't see how I'm going to pull all this off. And, if circumstances were different, and they're not, but if they were different, if my mom was still healthy, or maybe if I had a couple really close friends in my life locally, the burden could kind of be shared. I wouldn't seem like this drain on one person. Like, Keith comes home and I'm always just telling him everything that's going on. He zones out and he's not listening to me. I know he's not listening to me. I wouldn't be listening to me. I'm surprised any of you who watch my videos continue to listen to me. Although I guess you're only getting like 15-minute doses of me every so many days, so maybe it's not that bad. You don't understand, it's like I sign off here, it's continuous. This is, constant. It was, even when I just had the anxiety, years ago, when it was just that, I said to this therapist once, I'm like, when I leave here and you go to lunch, I still have the anxiety. When I go to bed, I have it, and when I wake up, I have it. It's like they kind of forget. They're just, sometimes, not all of them, but I think sometimes they forget. It's like, I don't just experience this during our 45-minute session. This is my life. And, I don't know, there's just so many, like my mom right now, they know that she has chronic diarrhea from the chemo. They don't know why it happened. it won't stop. That's why she can't gain weight. She's been off chemo now for over a year, and it has not, her colon has not gone back to normal. And she says to the doctor, well, sometimes I just want to be able to go out. And the doctor says to her, well, if you want to see a movie, I mean, couldn't you just sit in the back row? And then if you had to get to the bathroom, you could. And my mom's like, no. I mean, they don't understand. My mom just can't stand up and go to the bathroom. She tells me recently that they have like these porta potty things that because she can't always get to the bathroom. And she tells me that, you know, before she goes to bed, since her body acts up, she sleeps sometimes the first 3 hours sitting on that with a pillow off to the side. And it's like, I don't think doctors completely get what people are going through unless they've been sick. And that brings me to one last topic. There is a gastroenterologist locally who has had cancer. And I made an appointment with her, and if you followed my blog, that was the office that called back and said, oh, I'm sorry, we are going to have to cancel your appointment. She's no longer taking new patients. But I want to try again, or I'm thinking about writing her a letter. Even though I already have another doctor in mind that I went to before, that he was pretty good, so I might use him again. But there's something inside me that just keeps saying, you know, contact her, try to get her just to take you. Because someone who has been sick, someone who could understand what I'm going through with my mother because she has gone through it, someone who could understand anxiety, possibly and fear, because her herself, not feeling well many times, knows what it's like not to feel well. It's not someone who's never felt sick. And that's, you know, even with friends that, you know, I talk to online or from my past, if they've never been sick like this, or like anyone else that's had something going on long term in their body, they don't quite understand what it's like. It can turn into, oh, it's been 8 months, you're still sick? Yeah. Still sick. And it gets to this thing of, well, I think people think you make it up eventually. You know, I read through my blog sometimes, which I try not to, because I don't really want to remember everything. But when I do, it sounds like a fictional story. It doesn't sound real. It's like, well, how could all that be going on? And I feel comforted because I find other people's blogs where all that's going on, you know, in their life too. Like they're sick, they have parents who are sick, or maybe their child's sick, and they're also ill. So it happens. It just kind of sucks when you don't have everything situated, you know, for yourself. But one thing I want to promise myself is that I ever do get through this and I get better, I am going to immediately get back out into the world and get some people in my life. I don't know if I'll stay in Albany. I might move back down to Florida if I get well. Well, depending. And once my mom's well, or if she doesn't get well and eventually passes away, which hopefully doesn't happen, I will probably not stay in Albany. I'll probably just return back to Florida. But neither here nor there. I need to get friends in my life. I need to get people there because this will eventually happen again. I mean, I'm going to get old, and as you get older, you're going to get sick or something else can happen. I don't want to ever be in this situation again where I don't have someone call and say, I know you've been through this, or could you please just take me to the doctor because I'm comfortable with you? And I just want that in my life next time. So if you're in a situation now where you're not sick like this and you don't have a support structure, trust me, build one now because you never know what could happen. I mean, you could just fall down the stairs and something could happen to you and you would be alone, and that's not a good place to be. So if you have anxiety, that's something you should work on. That's something I should have because I'm now paying the price for not having that. And you don't want to be in this situation because you know yourself. With anxiety, there's things you won't do. I mean, you know you could be hungry and not go to a store. So you'll sit there and starve until someone brings you food or until you actually can go on your own. So imagine now not being able to really go at all. And then what happens? So just things to think about. I mean, things I have to think about. And just kind of, like I said, I babble out. Said it wouldn't be a long video, but it is. So sorry. I will try to make another one soon. Bye. Hey everyone, I'm back. Just wanted to make a video. I didn't make any for a couple days because my roommate was off and I don't usually make videos when anyone's here. And plus I haven't been feeling that well. Surprise. You know? What? You're not feeling well? That's rare. No, but you guys know how I'm like really against a lot of different medications, but I'm really considering getting one off right now actually. That's why I'm always clearing my throat in my videos. It's like I always have like stuff like hitting my throat, and it hurts to breathe. I think that when I'm sleeping, if it is acid, that I'm somehow inhaling it, or not like into my lungs, but just it's irritating like my bronchial tubes or something. Because I get these coughing fits and it'll wake me up, or I wake up and I'm not breathing. One of the prescription drugs that they had me on before, Prevlicid, was at the time only available by prescription, and now it's over the counter, and it's a much lower dose, but you know, like anything else, you can just double it up to make it prescription strength if you had to. And I know that's what they would give me anyway at this point, just having a lot of burning going on. And it's weird because, you know, someone had mentioned to me, well, actually a couple people, but the most recent person is just like, well, you should be really checked for celiac disease. You could have a gluten intolerance. You sound like me. Maybe. I don't know. But I will say this. I mean, I don't know. It could be, when it comes to the upper part, I mean, I have so many problems, as you know, but when it comes to the upper part, it could be GERD, acid reflux, whatever. But what's interesting is, I have it over here, is, like, you know, when you have heartburn, people are like, oh, eat bread and stuff like that. So I was eating bread, and shortly after I eat it, I mean, my stomach goes on fire. And I woke up today and I had, you know, some bread, and now it's just really burning in my stomach, and it makes me cough a lot. I don't know why that happens. I'm trying not to cough.